I was ashamed, I was embarrassed, I was lost, like confused.
Nearly 7 hours. That's how long this local woman says she waited to see a sexual assault nurse examiner at a Charlotte hospital.
But that nurse never arrived, and she says it may have cost her a chance at justice.
In a night investigation, our Joe Bruno is asking why the woman was left waiting for help and then sent home without it.
No one deserves that. No man, woman, or child.
She asked we not show her face or use her name. But this Indian land woman says last August she was sexually assaulted. To press charges and build a case, police told her to go to the hospital and see a sexual assault nurse examiner, more commonly called a SANE. So she drove to Novant SANE Hospital.
Before even checking in, I asked them at the desk, do you have this type of nurse available? The lady there, she actually made a phone call somewhere, and it was a few moments, and she said, yes, this person is here.
But that person was not there, and it took nearly 7 hours to find that out.
I was ashamed, I was embarrassed, I was lost, like confused.
She says during that time at Novant SANE, she had to keep retelling her story of sexual assault, each time hearing a different reason as to why a SANE nurse wasn't available.
We're looking for this person. We're waiting for them to answer the page. Someone may be in the facility that can do it, and it just kept changing. And I kept waiting, because I need this done.
After 7 hours, she says a nurse came in and gave it to her straight.
I think she just kind of felt bad for me. She came in and she pretty much told me, she said, no one is here, no one is coming.
She says she was told to come back the next morning and that she would be prioritized. So she left, didn't shower, and returned the next day. But again, no SANE nurse was available.
I was told then that these nurses, or this nurse, was at some sort of convention. What she said was a SANE nurse convention. I've never heard anything of a sort. No one touched me. No one looked at me.
She filed a complaint with North Carolina's Department of Health and Human Services. The agency conducted an unannounced site visit in December and found Novant SANE did not have a SANE nurse available to do a sexual assault examination. Novant declined to speak with us on camera for this report, but a spokesperson emailed, our emergency medicine teams, including physicians, advanced practice providers, and nurses, are always equipped and available 24/7 to provide care for patients who have experienced sexual assault. These exams are offered whenever clinically appropriate at all Novant Health medical centers with the utmost concern for each patient's dignity, safety, and healing. This woman wants to know, if that's the case, why wasn't an exam offered to her?
This is the part that I don't understand. Even you would think even they would have like a female doctor just come in, like, humor me, something.
Novant did not answer follow-up questions about the patient and claimed they do not have a way to confirm if all of its SANE nurses were at a convention. But I found there was an international conference on forensic nursing that weekend in Colorado. Neither North nor South Carolina require hospitals to have a specialized SANE nurse on duty, and there's no easy way for patients to find out if there's one available at a given moment.
I think that there is an ongoing need for sexual assault nurse examiners.
Corey Goldstein with Safe Alliance says while an ER doctor may be able to perform the exam, there are advantages to seeing a SANE nurse.
A SANE nurse is going to have extra training around ensuring that they're not only meeting the medical pieces and meeting the medical obligations, but they're also going to be working in that trauma-informed manner in supporting a survivor throughout the process.
According to the International Association of Forensic Nurses, only 17 to 20% of American hospitals have SANEs on staff. In 2022, then North Carolina Attorney General Josh Stein announced a new program aimed at training 50 North Carolina nurses to serve as SANE nurses. State Senator Whitson Bradley is a sexual assault survivor and says North Carolina should find ways to get more SANE nurses in hospitals.
No person in the greatest time of need, having this amount of trauma, should go seeking help and not find the qualified person that they were told was going to be there.
I need to know that this is going to be fixed.
The woman says she was not able to move forward with criminal charges because she did not get an exam during those 2 days. She says she's committed to using her voice, so what happened to her won't happen to anyone else. Reporting in Ballantyne, Joe Bruno, Channel 9 Eyewitness News.
Now, Safe Alliance is building a new facility in East Charlotte to provide services for survivors of sexual assault, domestic violence, and abuse. This is going to be called the Umbrella Center. Plans call for dedicated sexual assault nurse examiners to work at this facility. If you or someone you know needs help, you can contact Safe Alliance. The Greater Charlotte Hope Line to contact them is on the screen, 980-771-4673. Help is available 24/7.